My name is Suraj Kadam and today we are discussed about antibiotics. Antibiotics, also known as antibacterials, and the antibiotics are medications that destroy or slow down the growth of bacteria. They include a range of powerful drugs and are used to treat diseases caused by bacteria. Antibiotics cannot treat viral infections such as cold, flu, and most coughs. The next is, what are antibiotics? Antibiotics are a common medication that doctors prescribe to fight bacteria. Antibiotics are powerful medications that fight certain infections and can save lives when used properly. They either stop bacteria from reproducing or destroy them. Before bacteria can multiply and cause symptoms, the immune system can typically kill them. White blood cells, means WBCs, attack harmful bacteria, and even if symptoms do occur, the immune system can usually cope and fight off the infection. Sometimes, however, the number of harmful bacteria is excessive and the immune system cannot fight them all. Antibiotics are useful in this scenario. The first antibiotic was penicillin. Penicillin based antibiotics such as ampicillin, amoxicillin, and penicillin G are still available to treat variety of infections and have been around for a long time. Several types of modern antibiotics are available and they are usually only available with the prescription in most countries. Topically, antibiotics are available over the counter creams and ointments. The next point is antibiotic resistance. Some medical professionals have concern that people are overusing antibiotics. They also believe that this overuse contributes towards the growing number of bacterial infections that are becoming resistant to antibacterial medications. According to the Centers for Disease Control, means CDC, outpatient antibiotic overuse is particular problem. Antibiotic use appears to be higher in some regions such as Southeast. Use of carbapenems, a major class of last line antibiotics, increased significantly from 2007 to 2010. The next is how antibiotics works on our body. There are different types of antibiotics which work in one of two ways. A bacterial antibiotic such as penicillin kills the bacteria. These drugs usually interfere with either the formation of the bacterial cell wall or its cell contents. A bacteriostatic stops bacteria from multiplying. The next point is the uses of antibiotics. Antibiotics are effective against viruses. A doctor prescribes antibiotics for the treatment of a bacterial infection. It is not effective against viruses. Know whether an infection is bacterial or viral helps to effectively treat it. Viruses Viruses cause most upper respiratory tract infections, URTIs, such as the common cold and flu. Antibiotics do not work against these viruses. If people overuse antibiotics or use them incorrectly, the bacteria might become resistant. This means that the antibiotic becomes less effective against the type of bacterium. As the bacteria has been able to improve its defenses, a doctor can prescribe a broad spectrum antibiotic to treat a wide range of infections. A narrow spectrum antibiotic is only effective against a few types of bacteria. Some antibiotics attack aerobic bacteria while other works against anaerobic bacteria. Aerobic bacteria need oxygen and anaerobic bacteria do not need oxygen. In some cases, a healthcare professional may provide antibiotics to prevent rather than treat an infection, as might be the case before surgery. This is the prophylactic use of antibiotics. Some people commonly use these antibiotics before bowel and orthopedic surgery. And next point is there are some side effects also. That are, the antibiotics commonly cause the following side effects: diarrhea, nausea, vomiting, rash, upset stomach. With certain antibiotics or prolonged use, fungal infections of mouth, digestive tract, and vagina. And there are also less common side effects of antibiotics includes formation of kidney stones when taking sulfonamides, abnormal blood clotting when taking some cephalosporins, sensitive to sunlight when taking tetracyclines, blood disorders when taking trimethorphins, deafness when taking erythromycin and aminoglycosides. Some people, especially older adults, may experience bowel inflammation which can lead to severe bloody diarrhea. In less common instances, penicillins, cephalosporins, and erythromycin can also cause inflamed bowels. The next point is allergy from antibacterials. Some people may develop an allergic reaction to antibiotics, especially penicillin's side effects might include a rash, swelling of tongue and face, and difficulty in breathing. Allergic reactions to antibiotics might be immediate or delayed. Hypersensitivity reactions. Any Anyone who have an allergic reaction to an antibiotic must tell their doctor or pharmacist. Reactions to antibiotics can be serious and sometimes fatal. They are called anaphylactic reactions. People with reduced liver or kidney function should be cautious when using antibiotics. This may affect the types of antibiotics they can use or the dose they receive. Likewise, women who are pregnant or breastfeeding should speak with a doctor about the best antibiotics to take. The next point is interactions of antibiotics. Individuals taking an antibiotic should not take other medicines or herbal remedies without speaking with a doctor first. Certain OTC medicines might also interact with antibiotics. Some doctors suggest that antibiotics can reduce the effectiveness of oral contraceptive. However, research does not generally support this. Nonetheless, people who experience diarrhea and vomiting or are not taking their oral contraceptive during illness because of an upset stomach might find that its effectiveness reduces. In these circumstances, take additional contraceptive precautions. The next point is how to use antibiotics. People must not stop a course of antibiotics halfway, though if in doubt, they can ask their doctor for advice. People usually take antibiotics by mouth, however, doctors can administer them by injection or apply them directly to the part of the body with infection. Most antibiotics start combating infection within a few hours. Complete the whole course of medication to prevent the return of the infection. Stopping the medication before the course has finished increases the risk that the bacteria will become resistant to further treatments. The ones that survive will have had some exposure to the antibiotic and may consequently develop resistance to it. And individuals need to complete the course of antibiotic treatment even after they see an improvement in symptoms. Do not take some antibiotics with certain foods and drinks. Take others on an empty stomach about an hour before meals or 2 hours after meals. Follow the instructions correctly for the medication to be effective. People taking metronidazole should not drink alcohol. Avoid dairy products when taking tetracyclines as these might disrupt the absorption of the medication. And now there are some questions also. Are there any bacteria that are resistant to all antibiotics? The answer is there are several different types of bacteria that are resistant to the antibiotics that have been the most effective against them. Some examples are there: ethicillin resistant Staphylococcus multi-drug resistance, Mycobacterium tuberculosis, Carbapenem resistant